Buenos días, buenas tardes, good morning, good evening, and good afternoon, and welcome back to the Making Mammy podcast. Today's guest is a nurse and mom who led one of South Florida's biggest trauma centers, and now she is running to be the next mayor of the village of Palmetto Bay. Let's please welcome my great friend, Karen Baez Wallis, to the show.
Thank you, Josie, for having me. I'm really grateful.
No, thank you. Thank you for joining us. I think that you're an amazing candidate, and the residents should get an opportunity to know you on a little bit more of a personal level and hear our conversation today. And so with that, let's get into a little bit of your background. Like I said, you're a nurse. And part of the reason that you even went into the healthcare industry was because of a really intimate experience that you had with healthcare and your father. Talk to us a little bit about that and your history through medicine.
So, yeah, I mean, my dad suffered a stroke unexpectedly, and I don't think anybody does, right? That's not something you're going to wake up today, I'm going to have a stroke. But he had a stroke, and I went to the hospital. We were at his bedside. At that point, I was pre-med, and I saw really that the person that was there was the nurse. The physicians were obviously involved in his care, and they were guiding us and taking great care of him. But I felt the intimacy coming from the nurse. She handheld, she answered questions. She made things very palatable and understandable to us and what the next couple of days would look like for him. And I fell in love with nursing. And this December will be a 30-year career of has far exceeded any expectation I could have had. The conversations, the moments, I recall many of them have scarred me. And those scars are still there, and I reflect back and lessons learned, but it has been just a really wonderful career for me.
Yeah, no, and I can imagine the intimacy of getting to work with patients on such a level, right? Because the nurses are the ones that you call when you press the button. They're the ones that are at your bedside, that help change, sometimes bathe, that do all types of things. And so I think your story is not just one that reflects heart, but it's interesting to see something that's not too common. Usually you see people go into the medical industry and, you know, if they want to be a doctor right off the bat, they hardly ever change to be a nurse. And yet you saw the dichotomy at play and understanding that while people sometimes regard the doctor as higher than the nurse, that there's a person behind the scenes that's underappreciated, which really great nurses often are. And you said, no, I don't need to be the doctor. I want to be the person in the room that gets their hands dirty and really interacts with patients in this way. And I think that's really beautiful.
And talking about difficult conversations, that conversation with my mother, that I was going to have a drastic change in careers. I vividly remember it, telling my mom, I'm going to be a nurse, voy a ser enfermera. And, my Cuban mother, la pobrecita, that initial reaction of, oh my God, you've been saying you're going to be a physician since you were 3-4 years old, and having that change. But now after the fact, she sees that was truly my calling. Nursing has truly been my calling, and to be at the moments that are most intimate to a family and to want to be there and to be expected to be there to answer those questions has been my greatest joy.
Yeah, and you genuinely had a really celebrated career as a nurse. And like I mentioned in my introduction, you were part of that effort, right, with the largest trauma center in South Florida. But not only were you part of it, but you actually helped to lead to its creation, right? You were part of that founding group and getting that initiative together. Not only was it a trauma center, but it included a pediatric emergency department. How did you do that? What was going on that you kind of felt this need, along with the others, I assume, that were part of this initiative, to really help in this community and target the South Dade area?
Well, it was a perfect storm of events that occurred. At the time, the COO at Jackson South happened to have gone to air rescue in some capacity, and the news was coming about that they were in the process of opening up a new trauma center. And so I heard about that, and I called up the director, Ryder, which I had been a nurse at many years back. And I said, hey, listen, is this really happening? He's like, yes, absolutely. I applied. I was granted an interview and was taken around what was going to be the trauma center once it got established. And I remember Dr. Enrique Ginsberg, we were in the C-suite, and he kind of leaned back and he said, well, you want it. And I do remember that because it wasn't that I wanted the job just for the sake of wanting the job, but the opportunity for a nurse to have a legacy project at that scale. It wasn't the largest trauma center. Obviously, there was 2 level 1 trauma centers already established at the time, Kendall Regional and Ryder Trauma Center. But the fact that we could establish a new trauma center and its impact for the entire south end of not just Miami-Dade County, but of the United States. Like, think about that. From 152nd Street all the way down to Key West, we were going to be the closest trauma center to them by air and ground. And that, I'm like, yeah, heck yeah, I want to do that. And nobody does anything at that magnitude as a silo. Obviously, there was Migoya and, there was money and the CFOs and the CNO, and it was an entire team. And a lot of work had already been already done, but the day that the state came and we had our survey, I was the one presenting and getting that letter to saying you are verified as a trauma center. Gina Diaz was our CEO, and there was confetti, and it's like just like, wow, we did it. We're now a level 2 trauma center. And then COVID happened. And I had been given the opportunity at that point to start leading the emergency department about 2 years prior to that, and overseeing that pandemic and the challenges with vaccination, providing care, decreased resources for a multitude of different reasons. And then finally, right before I left, it was opening up the 4-bed pediatric ER. So it's just been really a great experience with the Jackson Health System, but to undertake that has, wow.
No, I can imagine. And also the gap that you were feeling at the time, right? Because the South really was lacking in healthcare. There was a huge gap down there. Like you said, you guys service not just South Miami-Dade County, not just Homestead, what I assume also is Palmetto Bay, Cutler Bay, but also the Keys, right? All the way to Key West. So that gap of service is absolutely crucial. If you're someone that's in Key West on vacation, or that you live there, or if you're down in Homestead, and God forbid something happens, you need to have that easy access to health care.
Right. And it's for trauma services, right? Because there are services down there. There's other facilities, there's hospitals that are along the US 1 corridor, but we're talking exclusively for trauma.
Yeah.
And even out in Biscayne Bay, or, if you're on your way to Bimini, and we happen to be your closest trauma center at that point. And by we, it was my previous employer, right, at Jackson. So yes, it was an incredible access to trauma services.
Absolutely. And that trauma service, like I said, it's absolutely essential, right? Especially along that corridor in the Keys where it's one way going in and one way going out. There's a lot of things that can happen. And so I think that change was a really big step for the South Dade and Monroe County communities. And so apart from being a nurse and from leading that amazing initiative and all your work in that respect, you've also done a significant amount of work in the human trafficking area prior to ever being involved with politics and civics. Talk to us about that, about your work regarding this human trafficking initiative that is so close to your heart, about your work with Safe Haven at home and Homestead Hospital and all that type of thing.
Well, all emergency departments are part of the Safe Haven network, as are police stations and fire stations. And human trafficking, there's always those CEUs, or continuing education units, about what does a person who's being a victim of human trafficking, or somebody who's being exploited, look like. And they talk about the lack of ID, the lack of eye contact, the inability to answer their own questions, and there is significant human trafficking here in South Florida. My component as a former director is really assuring that the nurses are aware that the appropriate posting signs are there, that we have safe spaces in which if somebody wants to either self-disclose, or if your healthcare workers, right, your staff feels like this person might be a victim, they're able to feel comfortable and in a safe space to say, there's a problem here. This doesn't feel right. And I think that that's what the nurses mostly, or even the providers, thinks the story doesn't sound right, doesn't feel right. I mention it as your spidey senses. If your spidey senses are tingling, you need to listen. And we ERs receive babies all the time. And at Jackson South, we would receive, people drive in and there would be a newborn that would be on the floorboard of the car, recently born. And we don't ask questions. You just want that child. You want to be able to provide a safe environment for the child. So human trafficking, for me, I think it's definitely underreported. There's more that we could do. I would love to continue championing that and how we can give that message out. But really, it's just providing a safe haven for the staff and education and letting people know about human trafficking. It is an issue. It could be the person who's cleaning your home. It could be somebody who's providing yard work. Human trafficking doesn't necessarily mean a sex worker, right? There's so many other things involved with human trafficking that we just need to make sure that we continue getting that message out and educating Miami-Dade County residents.
Absolutely. And in regard to the numbers, you're so right in that it's underreported. And I mean, as part of the Commission for Women, we do the CDAW report and we collect data on human trafficking every year. And even with the numbers being underreported, Miami-Dade County is one of the highest, if not the highest, depending on the year, county with the highest amount of human trafficking. And so this is a real problem for our community, and addressing that issue in the South Dade area where so many things go unnoticed is so particularly necessary. And I think the work in regard to the babies, right, and the safe havens and having that available not only is invaluable, but it's really something that pulls at your heart, right? I can only imagine what you were feeling as a nurse, receiving those babies in a car and just having them be dropped off and really wanting so desperately to provide that aid and support and care for what is essentially a helpless child.
Correct. Correct. And, I think young women need to know that is there, right? There are statutory requirements as to what is considered the appropriate time to bring that child into the ER. Or to a fire station, but there's no questions asked. There's no questions asked. We just want, if that's something that that young woman is feeling the need to do, we'd rather accept that child, and we ask no questions, versus the other end of what could happen to that child that is not wanted at the time of birth. So I think it's a wonderful not-for-profit. It's a great opportunity to provide a safe catchment of that newborn.
Of course. And so, all throughout so far your career, and this is even before you've ever stepped foot into politics or the civic space, I see such a line of service and dedication. And knowing you personally, knowing your family, I know that this is something that runs even deeper than just you. Your husband is also a veteran. You're wearing your pin right now in honor of him. And that's a cause that's so close to your heart, especially, the South Dade area has a huge community of veterans, of law enforcement, of Gold Star families. How does it feel for you to be part of a community like that? And how does that help make Palmetto Bay so special?
Well, I'd be amiss if I don't say they're coveted wings of gold. That's a Navy thing, but
move over to the side a little bit so people can see your pin.
How about that?
Yeah.
Okay. So
Very
my
nice.
coveted wings of gold, and I do wear them with pride. I'm really proud of not just my husband, but we are a Navy family. I lived in Annapolis for a long time, and the Military Affairs Council that we have here in South Florida and the services available for veterans, it is a cause near to my heart because we're impacted and we're touched by it. And we are a family embedded. I was actually in JROTC when I went to Killian. I love our service members, but I was also, they called them fire rescue explorers at the time. I was 16 and I was through Miami-Dade Fire Rescue Explorer program. And so just always wanting to find different avenues to be able to provide different services to our community. From a young age, I was a Girl Scout and then a fire rescue explorer. And then while I Killian and JROTC, and now the wife of a veteran, the wife of a first responder, and my son is on his way. He's a certified firefighter, but will be the mother of a first responder. And what that means, it's full circle for me because we are trying to teach, or we are teaching our children to have love of country and community. And then my daughter is also moving up through the ranks. In November, she was awarded the American Legion Medal for advocacy of a green space within the village. That was an initiative she did. And as a mother, I felt compelled to support her as a 10-year-old. What she felt strongly about, and how can I support a young woman who wants to have a voice in a community that, she's 10, she's a child, and how she could find her little space in that, and so it's been. Public service or servant leadership is not new to me, and it's not new to my family. And so we are called to serve in whatever capacity that might be.
Absolutely. And I think that servant's heart is so beautiful, and it's so special about your candidacy and your family. Like I said a second ago, right, I've met your family, and I know the incredible people that they are. And I know, especially your daughter, to me is so impressive because, like you said, she's 10 years old, and she's advocated for this green space, and she's spoken at council meetings before politicians as a young girl, someone that's your daughter's in 4th grade, 5th?
Well, she's actually, at that time, she was 4th and 5th grade. Now she's moved on. She's 12, a middle schooler. Yes.
Now she's a big girl.
We're a 7th grader now.
Oh my gosh.
But yeah, at the time, to have a 10-year-old up there addressing the council, extremely proud of that. And, she wasn't being prompted by her mom. She wrote her own words. She spoke them up there. She did ask me, come with me, because she was nervous. Of course. But those were her words, and that was what her heart was speaking. And so very proud of her.
And I can only imagine that speaks to the values that you and your husband are instilling at home, and that you two carry in your hearts as individuals every single day. And, again, speaking to that love of community, country, family, you've been super active in the Palmetto Bay area for a very long time, very concerned for your community and dedicated to it. In fact, you were part of a women's history segment that they did a while back, and that was very fun to watch. How long have you been in Palmetto Bay, and what caused you to get involved in a more civic capacity there?
So I lived in Palmetto Bay for 14 years now, going on 14. And honestly, I'm a resident just like everybody else. For the most part, 90% of the residents are just happy to be there. It's a small little bubble. It feels pristine in certain ways. It does have its challenges, and we may not see eye to eye, but Palmetto Bay is a special place. At least I feel it is. But what really got me to be a community advocate and start being involved was COVID. As the COVID pandemic started evolving and we started seeing, I started seeing a need to reach out to local leaders and say, hey, this is what we've got going on. This is what we're seeing, the numbers, what resources we have, what's available to the residents. And if you remember, Josie, back at the beginning of the pandemic, families were not able to come in and be with their loved ones. And so I reached out to the mayor at the time. I didn't have much of a relationship with her other than she had canvassed and we had some conversations. And I'm like, hey, listen, I'm the director of the emergency department in the trauma center at Jackson South. What services can I help provide? What questions? This is what we're seeing, and starting to help them too, as leaders, know what we were seeing, what we had available, testing, whatever it might be. And so I started doing kind of like a Zoom with her, open mic, have people call, ask questions. We were wiping down supermarket, our groceries, right? We were, it was just looking back, very surreal time. And that's really how I started getting involved. And also with the trauma center, when that started manifesting itself, like around 2016, doing policies, reaching out to EMS, emergency medical services, to make sure that we bridge gaps that we were having of trust, that they felt comfortable bringing their patients to us and what we were providing so they could see the good work that we were doing. So that's how I started getting really embedded and involved within Palmetto Bay.
Yeah, there's not a lot of nurses in policymaking at all. So I think that it's interesting to have that perspective in there, especially as you serve a community that is so close to a trauma center like that one, and that from an organizational standpoint, you could bring that sort of feedback and understanding, because I think the level that you were operating at heading that center and other things that you've been in leadership positions throughout your career, because I know you've held several leadership positions, right? Requires an understanding of systems and management of people that not a lot of people have. That's a very rare talent. And how beautiful was it that you were able to connect with Mayor Cunningham and really spearhead that initiative and have your civic leader listen to you and to your suggestions and be open to this help to the community, right? Not all leaders are open to doing that type of thing or to sitting down and having that conversation and that exchange of ideas with a resident. It's particularly one that they've only had a handful of exchanges with before. So that, I think, to me also reflects perhaps the type of person that you would be in office, that anybody could perhaps come to your door, knock, give a great idea, and that you would collaborate with the residents on a great initiative such as that one. And so, thinking about Palmetto Bay and the matters that face that community, the things that the residents there care about, one of the biggest issues in Palmetto Bay and Miami-Dade in general is traffic. So, what are you thinking of doing in that regard? What are you thinking about, managing those tough thoroughfares that are controlled by the county and that sort of general issue that you're seeing down south with the traffic, particularly during, those rush hour times?
So transportation. So traffic in Palmetto Bay definitely is a challenge. And we have now the BRT, and ridership is ridership is up within the BRT. However, the culture within Miami-Dade County is not really to use mass transit. Just having taken a trip to Washington, D.C., it was very easy to get on the rail. We got into the metro and we were able to go all throughout Washington, D.C., but that's not really what we've seen in Miami-Dade County. And I would have loved to have seen rail extend down through Florida City and the Homestead area to allow for mass transit. I've heard plans from the current candidates for commissioner to bring more jobs down south. So we are stopping the north commute to massive jobs, but we need to also partnership with businesses within Palmetto Bay to see that people can have work, live, spend money, and be local. So traffic will always be a problem. But one of the other issues that we have in Palmetto Bay is that there are a lot of county roads that are traversing Palmetto Bay. And the county does have on their master transportation plan, their plan as to what they're going to do with those roads. We have been involved in litigation in the past. By we, I mean the village in the past has been involved in litigation. You were there during the ribbon cutting of the bridge on 87th Avenue. And I have seen EMS traveling that bridge, and the commute definitely is shorter, and our residents are able to get north and south. But moving and decreasing the density, I think, is what's going to impact the traffic that we're experiencing the most. The traffic that we're seeing through our streets are A, cut through, and B, we have an incredible amount of overdevelopment that's happened both to the north of us and, more importantly, now to the south of us. District 3 has seen a lot of apartment complexes that are being built, and then Cutler Bay has had a massive explosion of development. And so as long as that development keeps happening within Miami-Dade County without the appropriate infrastructure, streets that people can traverse north, south, and as well east and west, Palmetto Bay will still be afflicted with traffic issues.
Yeah, and so what I'm hearing really is a couple main points, right? Working with the county, right? Making sure that they extend those transportation master plans so that South Dade connectivity, I know that there is the South Dade corridor that's planned there, and so that's really fully fleshed out, and to create more of that culture of you can take mass transit, it's reliable, you have a bus, you have the Metro Rail, etc., and that those things will function and be on time.
And in addition to that, we also have freebies that people can jump on.
Freebies are very popular.
Yeah, that they can jump on, jump off, and be able to access the busways. We now have the Waymos. I've been seeing them driving around. So maybe we can kind of release our hold on cars and be able to use rideshare programs. So I think that being able to be much more creative in how we get from point A to point B is also going to be very important.
Yeah, and also emphasizing how you mentioned those local businesses, right? Really focusing on local entrepreneurs in the South Dade area and Palmetto Bay, and creating an industry for them where it's available, so that you have a little bit of what Commissioner Roberto Gonzalez, which doesn't represent your area, but I think he has a similar problem in Kendall, calls live, work, play, right? Creating that live, work, play in Palmetto Palmetto Bay, so that there's not a lot of that commute down, up to the north. And so people don't have to go so far for work. They can just go down a few blocks or go down a few streets, and they're right at work, and they're right by their house, and they're right by their movie theaters and their entertainment, and really rounding out your business community, and then making sure that there's a balance in what's going on and what's being built in your city.
And with live, work, play, I will challenge the fact that you have to be able to work and be able to pay your rent. And so, when we're doing a lot of mixed use buildings, the industry that's going in there, when your rent is $3,000-$4,000 a month and you're working at a Subway or a barber shop or whatever, being able to make your daily expenses is going to be very challenging. So when we say,
truly making affordable housing
affordable housing. The other challenge that we have is that there's a lot of density that's being built east of Old Cutler. Old Cutler right now is a two-way road, one up, one down. It's a historic road, can't be expanded, and quite frankly, we really shouldn't, right? It's got a beautiful tree canopy. And so the old, what's known as the Burger King property, has been sold, that they're going to put significant number of dwellings. It's slated for commercial and certain real estate issues, and what the burden of traffic will be on Old Cutler once that project is, actually built. And then now we have another property that it's in the middle of like another executive session, another litigation for Palmetto Bay. However, it's zoned as an R1, and that is what's known as the previous FPL property. And I would love to see single family homes there, either one house per acre, not as much density, right? Not high rises and things like that. And that has access to Biscayne Bay. So back to the third part of my campaign is being good stewards to our environment, that property is abutting Biscayne Bay. We have mangroves, and if we dredge canals, how is that going to impact our bay and our mangroves and other things? So traffic. Yes.
Yeah. And another huge topic for the South and for Palmetto Bay in particular is property taxes. 43% of Palmetto Bay's budget and revenues comes from property tax revenues. And so, if that reform were to go through, what do you think this means for Palmetto Bay, and what types of steps do you think the town would need to take in order to preserve itself?
Well, they're in the process of doing budget right now, whether or not to raise the budget, the millage. That is, whatever the current council decides will fall upon the next council that takes over in December, that gets elected into that. So we're going to have to live with those budgetary decisions now. But we do need to increase our portfolio. We are very heavily based on homesteaded homes right now. But back to the initial question about traffic and bringing in other industry in there, we're going to need to really diversify our portfolio, hopefully along that US 1 corridor, and make it something that businesses are going to want to come and work in Palmetto Bay.
What do you think generally are the biggest ways that Palmetto Bay can be improved? What would be your top priorities as mayor?
Well, we've had really protecting public safety is really big when I've been knocking on doors and speaking to people. So maintaining that level of public safety. Our parks are absolutely beautiful and incredible services are being provided. I think we need to broaden the services that are being provided to our elderly and our geriatric population, because they are going to other areas, either Pinecrest or Cutler Bay, to utilize some of their services. But right now it's maintaining the level of services that we have come to love and enjoy in Palmetto Bay, hoping to see what happens on the ballot in November 3rd.
Yeah. And so, Karen, for our last question, what is your promise to the residents of Palmetto Bay? What do you have to say to them ahead of your election on November 3rd?
My promise to the residents of Palmetto Bay is that I have led with a heart of a servant leader. I'm a listener. I am not judgmental. I come very open to listen to both sides. But the reality is that the decisions I make, you're not going to please everybody 100% of the time. But being able to make the decisions that are for the best, for the future, to forecast where we want Palmetto Bay to be together, that's what I want to stand for.
Absolutely. And I think that's a great premise and a platform and an attitude to take in, as I'm sure you're going to be elected very soon, the next mayor of Palmetto Bay. So thank you, Karen, for being with us. Thank everyone that's joined us today for watching. And please remember that if you live in Palmetto Bay, to get out and vote for Karen Baez Wallis on November 3rd.
Thank you so much. I really appreciate it, Josie.
Thanks, Karen.